All right. Good morning, everyone. I hope we all received the lecture that I sent you guys for Tuesday. It's posted on the module and I emailed you guys. So I hope you got a chance to watch it before this one. Um, the lecture would make more sense if you did that. If not, please make sure you watch it as soon as possible because you'll need it to take your quiz today. And I can also tell you that one of the slides from that lecture is definitely going to be an essay question on the final. So you will need to watch it eventually. So just a reminder, your policy brief is due today at 11 a.m. I see that a lot of you have already submitted it. So please make sure that you're submitting it on Canvas. That's where I'm seeing it. So far, no one has emailed it to me, which is very exciting. So you guys are following instructions perfectly. So make sure you submit it on Canvas under the policy brief tab for assignment. And let me know if you have any questions with that. I'm going to grade them as quickly as I can. Pretty much if you did really well, I'm not going to leave any comments. I'll just leave a comment if there were like significant problems so that you can kind of understand what you did. But I'm happy to walk you through your grade if you need me to do that. I'm thinking I can have them graded probably in the next 2 weeks or so, hopefully sooner than that. So just stay tuned for that. I'm not going to release the grades until everybody's is graded. But if you want to contact me separately, I can let you know what your grade is if it's been graded. All right. Do we have any questions before we begin? No questions? Okay, so we're going to go through the end of the lecture. It won't take very long, probably about 30, 45 minutes. And then what I'll do is pull up the Jeopardy sheet and let you guys know who's playing Jeopardy on Tuesday so that you know not to take your quiz today. But reminder, we will be, the quiz will be available starting at 10:45 this morning. So let me share my screen and we will get started. So in the last class, my internet randomly went out and I was kicked out of my own Zoom meeting for about 5 minutes. So hopefully that will not happen this time. It resumed and worked after that. So I don't really know what happened, but just a warning, if I disappear, I'll be back. Okay, so in the lecture that I pre-recorded and sent you guys, I just went over the overrepresentation of mentally ill offenders in our current prisons and jails. If you ever have the opportunity to talk to a correctional officer or anybody who works in an institution, I'm fairly certain this is one of the things that they'll complain about is how many mentally ill offenders are in their system. This is the big slide that you guys really need to understand for, it sort of brings everything full circle and you'll definitely be tested on it. So long story short, in 1972, the Supreme Court ruled that people with mental illnesses have a constitutional right to treatment because prior to that, there were too many people locked up in psychiatric hospitals, which were underfunded and understaffed, and they were basically just drugging everybody and throwing them in a room without treatment. So the Supreme Court said, you guys can't do that. So pretty much what happened is they just released like half of their patients so that they did have the resources to care for the others. And then the state said, okay, we have, 4 mental health facilities that are only half full, so we're going to close 2 and consolidate. We have not considerably built up community mental health since then, which is why so many of them wind up in the criminal justice system. So one of the new ways that we're trying to decriminalize having a mental illness is through mental health courts. So just like the drug courts, the Veterans Treatment Court, the prostitution court, same idea for specified low-level offenses, although some states will accept you if you have a violent felony, but that's not really common. Basically, just like the other ones, you see a judge, you set up appointments in the community, you are supposed to use the judicial coercion of the criminal justice system to force you into treatment. So now what we're going to start with is if you are not diverted out of the criminal justice system and you are in an institution, what kind of treatment can you get while you're incarcerated? So we're going to look at a study from 2007. This was a really cool study. It's a retrospective study of 104 male inmates with an SMI, which I know for you guys means, what is it, Saturday morning inspection? That's not what we mean here. We mean a serious mental illness. So that's what I'll be referring to throughout the remainder of the lecture. So what these researchers did was they identified 104 people with a serious mental illness that had been incarcerated in the LA County Jail, and they wanted to look at their experiences while they were in there. So the LA County Jail is a huge jail that is really well funded. It's very similar to the Al Cannon Detention Center that we have here in town. Not every county is going to have a jail of this size with these resources. So I'm going to speak about if you have a mental illness and you're incarcerated in a well-funded, nice jail, this is what your experience looks like. But just keep in mind that a lot of these little local county jails, it doesn't look like this. So it's really unfortunate that we can't do our jail tour like we do every semester because of the plague. Because I like for you guys to get an understanding of what a nice, well-funded local jail looks like. So let's get started. So this study was able to tell us several things about the mental health care system or mental health care in the criminal justice system. So what they found was that 78 out of the 104 people with an SMI were properly diagnosed while they were incarcerated in this jail. And out of those 78, 59 of them required inpatient care, meaning they had to be in a specific wing of the hospital where they were receiving round-the-clock care. Usually somebody that needs inpatient care is somebody that's having a mental health crisis and cannot be out in the general population, or even in the general population within the mental health wing. They need to be like in their own room being supervised. So in the mental health unit of the LA County Jail, 32% of them required acute hospitalization, meaning they were in their own room with their own bed with nurses watching them. And 44% of them were placed on lockdown, meaning they were in their own room with a straitjacket, round-the-clock care. Usually, if you are in lockdown, they're going to have a guard walk by every 15 minutes to make sure that you're not harming yourself. So what we see here is that 76%, or 59 out of those 78, required serious help while they were in the correctional system, and they got it. So just looking at the demographics of these people that were incarcerated, 92% of them had a history of non-adherence to their meds. So this is not surprising. If you have a serious mental illness, this is the biggest problem, is trying to get this person to stay on their meds, because it's when they go off their meds that they usually wind up in a psychiatric hospital, or if that bed isn't available, in the criminal justice system. So people going off their meds when they have serious mental illnesses usually occurs for one of two reasons. And I'm giving you a very broad generalization. There are a number of other reasons that we don't have time to go into, but the two big reasons are they are on their meds, they're stable, they feel good, and then they think not that they think they're cured, but they feel good enough to go off their meds. So that's a recurring problem that we often see. Another reason why mentally ill offenders go off their meds is because a lot of these really strong antipsychotic medications have really challenging side effects that make it really uncomfortable for them to just be living. So some of them make you really, really tired. Some of them have a side effect is like excess saliva, like way too much saliva. Sometimes they make you itch. There's just a lot of very uncomfortable side effects that go along with antipsychotic medications, and trying to get that perfect chemical balance can be an uncomfortable feeling for these offenders or for somebody with a mental illness. So because of either uncomfortable side effects or feeling very stable, a lot of times they go off their meds. So 72% of the people that were in this study that wound up in a correctional setting had prior violent arrests. 76% of them had substance abuse, which is not surprising. If you recall from the pre-recorded lecture, a common trait amongst people with mental illnesses is something called a co-occurring disorder or a dual diagnosis or comorbidity. They all mean the same thing. It means that you have a mental illness and a substance abuse problem. So it's not that surprising that, you know, over 2/3 of this sample, 3/4 of this sample had a history of substance abuse. The other thing that we see from this is about 1/3 of them were homeless. And if you recall from the pre-recorded lecture, there is a significant correlation between the rise of the homeless population in the US and deinstitutionalization. When all those institutions closed, all of a sudden the homeless population in the US skyrocketed. So it's not surprising that these guys, about 1/3 of them are homeless. So let's talk a little bit more about the type of treatment these people got in the LA County Jail. So the way it works in the LA County Jail, it also works this way for the Al Cannon Detention Center here in town and most reception centers. What they do here is they give a 15-item psychiatric questionnaire. And if somebody checks yes to any of those questions, or the intake officer feels that they appear odd in any way, then they are sent to a psychiatric professional who does a more in-depth analysis to see if this person either has a mental illness or is presenting the symptoms of a mental illness and should maybe be in the mental health wing. So at the LA County Jail, the mental health wing is the Twin Towers side. And for the Al Cannon Detention Center, it's usually the Special Management Unit. So most large jails have a wing specifically for people with mental illnesses. So at the LA County Jail, once they're admitted to the mental health housing unit, which is the Twin Towers part, there are 3 areas within that for people with mental illnesses. And again, a large, well-funded jail, you'll see something similar. So there's the acute inpatient area where you can be in a bed and you're receiving sort of round-the-clock care. That's for somebody that's in a mental health crisis, or we are trying to get your meds straight. And we're kind of sort of playing around with the chemical balance, which meds need to be combined to get you stable. There's also a lockdown area where you're in your own cell, usually either chained to a bed or in a straitjacket. The lockdown area is for someone that is in a mental health crisis, but is a danger to themselves or others. And if they're in their own cell in a straitjacket, that's when we have a correctional officer going by every 15 minutes to check on them. And then we have the general treatment area, which is basically like the general population, but in that mental health wing. So I think I see a few of you that may have been on the jail tour with me before. I think Roger, maybe Cameron and Evan. So when we walk, and James, I think maybe you have been on the jail tour. Yeah. So the general treatment area, like when we walk through the jail and you see those pods, and you can look into the room and see they've got their beds along the side of the wall, and in the center they have sort of tables and chairs. They've got like a bathroom area for everybody to use. That's what it looks like in the mental health wing. And you guys that have been in the jail, you saw the Special Management Unit. They have that general treatment area, but they will also have the areas in the back for like lockdown and acute inpatient. Oh, Stephen, you also went on the jail tour. Yes, exactly. So you know what I'm talking about. Okay. All right. So what did we learn from the Lamb and colleagues study? So considering that 59 out of the 78 inmates with a serious mental illness received the acute inpatient treatment that they needed, it can be concluded that a large percentage of the study sample of people with serious mental illnesses receive the treatment they needed in the criminal justice system. Again, this is a large, well-funded jail. The study also noted that the inmates in the treatment area were in the jail for a wide range of crimes. So that percentage I showed you before, 72% of them had a history of violent arrests, but when examining the reasons why they were currently incarcerated, it was all over the place. So a lot of them were there for violent reasons, but there were also a lot of them that were there for nonviolent reasons. So for instance, this study told the story of the guy they called the lemon thief. So this guy was arrested for burglary and brought to the LA County Jail because he was jumping over the fence of a neighbor's lemon tree farm, and he was picking the lemons up off the ground, shouting at them, and then throwing them at the trees. So the researchers are saying, yeah, for the most part, we did a good job, but diversion needs to be better for people like the lemon thief who probably don't need to be in an incarcerated setting. So the other thing that we can take from this study is that the biggest percentage, the most common characteristic of the people that wound up in this jail is non-adherence to their drugs. So going off their meds. So what we see here is that most of these people seem stable until they go off their meds, and that's when they need intervention either from the mental health system, or if we can't find a bed for them there because we don't have enough, that's when the criminal justice system has to step in. So we'll get to the recommendations in a minute, but basically what I'm getting at is we need to continuously follow up on these people because it's when they go off their meds that they get in trouble. The other thing that we can take from this, and then if we just flip back quickly and look at the characteristics of the people in this sample, going off their meds, violent arrests, substance abuse, homelessness. These people are going to be a challenge in any treatment setting. So this is a tough population of people to deal with. So, you know, the criminal justice system is doing the best that they can, but really we need to expand the mental health system. So given the characteristics of these people, it's safe to assume that most of the inmates with a serious mental illness are going to present a major challenge for treatment in any setting. So the recommendations that these researchers made based on this study is that if we want to reverse the trend of criminalization of mental illnesses, diversion needs to be the first step. But if we are going to say that the criminal justice system doesn't want to hold them and we want to divert them into the community, we need to expand the mental health system and the availability of treatment in the community. So we need to have a large increase in psychiatric treatment and rehabilitation resources so that the mental health system can absorb the people that we are trying to divert out of the criminal justice system. So what we see here is that we need to expand the mental health system so that we can divert these people out. So we have this assertive community treatment using mental health courts to help divert them out, and assistant outpatient treatment with follow-up, because we know these people go off their meds for a number of reasons. So we need to continuously check up on them so that we can keep them on their meds. So now what I want to talk about is intensive case management. So this is an example when I keep saying diverting them out into the community to receive mental health treatment. This is an example of what community mental health treatment looks like. So intensive case management is a very common one. You see this all across the nation. And like I said, it's an example of what can happen to a mentally ill offender who's been diverted from the criminal justice system. So ICM deals with case management. So this is a term that might sound familiar. We've talked about this a lot. When we talked about the prostitution court, that dealt with case management as well. So basically having one person that can help them with all of their problems. So case management, when we're talking about the mental health field, is a community-based intervention that focuses on services brought to the client in their natural environment. So if they are in jail and getting ready to be released, the case manager comes to them and meets with them in jail and prepares them for release. If they're out in the community, the case manager comes to their home and helps them with everything that they need. A lot of these people don't have reliable transportation or just do better in a comfortable environment. So it's best to bring services to them. So the other thing that you have to think about is they kind of need an unlimited time frame. This is not something that short-term treatment is going to deal with. Like I was saying, these are a challenging group of people, and a mental illness that is serious is not going away. So they basically need unlimited help for the extended future. So they also need 24 availability of the staff because you never really know when a mental health crisis is going to happen, and a range of services provided. So just like we've talked about before, Some of the same problems persist for these offenders as well. So we need things with helping them make referrals to treatment. So they need to get connected with a mental health provider in the community, assisting with getting their prescription. So we can have a case manager that picks up their prescriptions and brings them to them, helping them to schedule appointments, helping them to attend appointments. So this is something that I actually have a friend who works in case management. She works in Portsmouth, New Hampshire, and their case management team includes a physical fitness mentor, and that's what my friend Tori does. So she goes to these clients' homes and tries to get them healthy. So she helps them with their diets. She usually helps them do something active every day. So she'll take them on a walk, or sometimes she goes swimming with them. But during COVID, she's had to help them with other things as well. So she, in the last week or so, multiple times, she's had to go out to a client's home and help them set up their computer or their phones for a Zoom appointment with their provider. So this is an example. An ICM usually has a team of people that help with stuff, and there's one case manager that they report to. So she's also told me multiple times, or I've heard all kinds of stories about all of the people that go to these clients' homes. They're always looking for evidence that this person has gone off their meds. So she's, sometimes we'll be chatting on the phone and she'll tell me that, one of her clients answered the door in a tinfoil hat. Or was talking about insane things like people reading their mind. And so that's when she texts the case manager and she's like, hey, I think so-and-so has gone off their meds, and the case manager will come over and double check that and try to get them back on their meds. A lot of times ICM includes helping them apply for jobs, practicing, doing some sort of interview practice. A lot of these people have trouble communication with their communication skills, so they'll help with that, as well as crisis intervention. So they've got one person to call if they're dealing with a mental health crisis. So because of all of these services that are provided, usually the case managers have pretty small caseloads. So, 10 to 25 clients. 25 is a lot. 10 is preferable because, like I said, these people need help with almost every aspect of their life. Another service they often help with is housing, because a lot of them are homeless. So all programs like this are intended to help people with mental illnesses remain out of psychiatric hospitals or the criminal justice system, integrate or reintegrate into the community safely, link them with community-based mental health services, and try to teach them how to manage their mental illness in the long term. So like I said, this is usually an unlimited time frame. But what they're hoping is that over time, they have to have less and less contact with this person because they can teach them how to manage their mental illness. So how effective is this? Again, remember the population we're talking about. What we have found, since we know that co-occurring disorders are so common, if you incorporate substance abuse treatment with this, it seems to work a little better because a lot of these guys have substance abuse problems, and sometimes they'll try to self-medicate with drugs and alcohol instead of taking their meds. So trying to get them into substance abuse treatment can be very helpful. And as far as how well this works in keeping them out of a restrictive environment like a psychiatric hospital or the criminal justice system, not amazing, because this is such a difficult population to deal with. Researchers have basically said this is an essential component. This is the best that we have, but just ICM is probably not sufficient to keep most of these people away from future arrests or incarcerations. Because so many of them go off their meds, a lot of times they wind up in the back of a squad car. So this is the best that we have, but it's unrealistic to assume that that population is going to be able to respond in 100% effectiveness to any sort of treatment. All right, questions about ICM before we talk about mentally ill offenders that wind up in Supermax prisons. All right, this right here, ICM with substance abuse treatment, that's what I would use for your policy implication, that incorporating substance abuse treatment into ICM seems to work best. All right, so this is an interesting topic. So if you've never taken intro, or you haven't taken intro with me, or you took intro with somebody that didn't cover Supermax, basically that's exactly what it sounds like. So we have minimum security prisons, medium security prisons, maximum security prisons, and then Supermax prisons. So a Supermax prison basically looks like solitary confinement. So if you went on the jail tour with me and you saw the behavioral management unit, that is what a Supermax prison looks like. So instead of having everybody sort of hanging out in the center in their pod all day, it's an extremely restrictive environment where you are locked in your cell 23 hours a day. Usually you're allowed out once a day for maybe an hour to kind of sort of walk around, but you're not supposed to be communicating with other inmates. It's a really restrictive environment, and as you might imagine, it's been highly criticized for worsening inmates' mental health. So people that don't have a mental health disorder, if they're in Supermax for long enough, they start developing the symptoms of mentally ill offenders. And if you do have a mental illness, it makes you a lot worse. So the goal of a Supermax prison is to incapacitate the worst of the worst. So an inmate can be placed in a Supermax prison for disrupting prison operations in the form of disregarding rules, assaulting other inmates or staff. But a lot of times Supermax prisoners consist of nuisance inmates, such as people with serious mental illnesses, in addition to the worst of the worst. So inmates with a mental illness are more likely to be involved in nuisance behavior. So it increases the odds that they're going to get shipped up to a Supermax prison. So like I said, critics have argued that prolonged exposure to Supermax confinement leads to neglect and deterioration of inmates' mental health. Researchers have found a positive correlation between mental health issues and how long you've been in a Supermax prison. So these facilities deal with two critical issues. They're trying to prevent the development of mental illnesses and try to manage the inmates' symptoms of mental illnesses over time. So Supermax prisons usually have a lot of psychiatric personnel as a result of this. So what we're going to look at is the state policies for tracking the mental health of their inmates in a Supermax prison. So the reason this is so important is because in 1995, there was a Supreme Court case that said it's unconstitutional to knowingly place someone with a mental illness in a Supermax prison because it makes you so much worse. So as a result, there are very few Supermaxes that will accept someone with a serious mental illness. So let's look at how we do that. So right now, what I'm showing you results from is a content analysis of 42 Supermax prisons. So a content analysis is looking at the policies and procedures, all the literature that's provided about placing someone with a mental illness in their facility. So of those 42, only 19% had specific directives for allowing someone with a mental illness in their Supermax prison. And that's because of that Supreme Court case. So the Supreme Court is basically saying, if you're going to accept someone with a mental illness, you better have a really good reason to do so. So the 19% of them that will accept them, basically in order to do so, they have to have a evidence from that. So let me back up. So if I'm the warden of a maximum security prison and I want to send one of my inmates that I know that has a mental illness into a Supermax prison, I have to present all kinds of documentation and evidence as to why my facility cannot hold this person any longer. So I submit that to the warden of a Supermax prison, and then all of that goes in front of a classification reviewing committee. and they determine if I can send my prisoner with a mental illness to a supermax prison. So the Supreme Court has said that's okay, but you can't just willy-nilly be sending people with serious mental illnesses into a supermax prison. There has to be a specific policy and a reviewing committee to make sure that we're trying to keep as many people with mental illnesses out of a supermax prison as possible. So the next two are going to talk about how the supermax prisons are making sure that people aren't getting worse in their facility. So evaluation. So how often are these inmates looked at to make sure that their symptoms aren't getting worse? So the first thing to note is that only about half of them require a preliminary or an immediate mental health evaluation. So that should send off a red flag. So if you're thinking back to some of the research methods that we talked about throughout this whole class, if you want to establish that something is happening, something's getting worse or something's getting better, the first thing you need is a baseline. So only about half of these facilities have directives in place to require an immediate mental health evaluation to establish a baseline. So the majority of them just have evaluations every 3 months or once a year, which makes it really difficult to tell if somebody is getting worse if we don't have that baseline understanding of where they were when they first came in. So reactionary strategies. So this means, what are they doing if they are all of a sudden realizing that one of their inmates is getting worse or starting to present symptoms of a mental illness that they didn't present before? So about a quarter of them just use a mental health watch. So if an inmate begins to display early symptoms of an SMI, they just kind of watch them and see if it gets much worse. Only about 14% of them have specific policies to transfer them to a mental health unit if this inmate starts displaying much worse symptoms of a serious mental illness. So what we can see here is that they sort of monitor them a little bit, and they have some policies in place to do something if they start having a mental health crisis. They're a prison, they're not a mental health ward. So they're doing the best they can. This is not really their job. And this is why researchers have been calling for expansion of the mental health system, better community treatment for mentally ill offenders, because a supermax prison is not a place for somebody with a serious mental illness. That needs to be dealt with by the mental health community. I understand if we've got someone with a serious mental illness that is terribly violent, then yes, this is probably the place for them. But in general, this is not the job of the criminal justice system. Their job is to punish and to rehabilitate, not to cure and to treat someone's mental illness. All right. Questions on mentally ill offenders in general, mentally ill offenders in supermax prisons? No questions? Okay, let's see who is playing Jeopardy this week. Evan, there you are. You are playing. Roger, you're playing. And Lucas. Okay, there you are. So, oh, wow, you three are like right at the top of my screen. That was easy. Okay, so you three are going to be playing Jeopardy on Tuesday. So don't take your quiz today, and you're going to play Jeopardy on Tuesday morning live. Okay, so everybody make sure you watch that pre-recorded lecture. If you haven't done so, your quiz will be available in 40 minutes. And in 55 minutes, your policy brief is due. So if you have not submitted it yet, let's get going on that. Just to clarify, each day that it's late, you lose 1 point. In the last class, I had a student who thought each week it's late, you lose a point. That is incorrect. No. So each weekday that it's late, let me clarify. I'm not counting weekends. Each weekday that it's late, you lose a point. Okay. It's out of 30 points. I'm going to do my best to get these graded as soon as possible. So yeah, let me know if you have any questions. If you have any last minute emergency policy brief questions, let me know. All right. If we have no other questions, then everybody have a nice weekend. Good luck on your quiz. Good luck on your policy brief. And I will see you all on Tuesday morning.